Earlier, we learned about cystometrogram or bladder pressure studies and how it is carried out in a low-cost setting. Today, we will discuss another investigation, which is usually carried out along with this investigation. This is called cystoscopy. It means looking inside the bladder. And there are two types of cystoscopes or scopes that we use for doing this. One is the rigid one, and another one is the flexible one. The rigid one has been there for a long time, and it has a telescope which transmits images from the bladder into the eyepiece. And now we have cameras which connect to the eyepiece and we can see it in the monitor. And the recent one is a flexible cystoscope, which has small fibers which transmit the pictures. The advantage of the flexible scope is that you can do the cystoscopy when the patient lying down comfortably. And what are the indications for doing cystoscopy? The most common indication that we do cystoscopy is for blood in the urine. This can be either gross hematuria, as we call it, or blood that can be seen with the eyes, or it could be microscopic, where only if you examine under the microscope, we can see the blood. The picture here shows a variety of causes for this bleeding. It can be cysts, it can be tumors in the kidney, tumors in the bladder, tumors in the ureter, and so on. But the important thing to notice is that if you diagnose these conditions early, it is possible for complete cure and treatment. And this bleeding gives patients the advantage that early diagnosis is possible. So any bleeding, whether it is gross or whether it is microscopic, or even if it happened a couple of weeks earlier, needs this investigation to find out what caused this bleeding. And again, the next most common indication for doing it is to evaluate what we call the lower urinary tract symptoms. So these are symptoms which we discussed in detail last time, for which we do the cystometrogram. So here there is hesitancy, then the urinary stream is poor, then we can have what is called intermittency, or the sensation of incomplete voiding, or increased daytime frequency, or passing more urine at the night, and so on. And these symptoms also will be aided by doing a cystoscopy, which will give a clear picture of what the condition is. Then we do the cystoscopy for what we call incontinence. Incontinence is, in layman terms, leaking a little bit of urine. So this can be a variety of types. It's called stress incontinence. If it leaks only when there is an increase in abdominal pressure, like coughing or laughing and so on. Or it can be urge incontinence. So when the bladder is full and there is a desire to pass urine, the patient can't hold it for a long time. Or it could be a mixed incontinence, or an overflow incontinence where there is a continuous leak. So before the procedure, we give prophylactic antibiotics. This is generally given in the form of an injection, either with one medication or two medication, depending on the local preferences. And then the patient is placed in what we call a lithotomy position. This is especially important if you're doing with the rigid cystoscope, because the urethra is a curved tube, and to pass a rigid scope, you need to make the urethra as straight as possible. So the picture on the left shows how the lithotomy position is. You can either have a low or standard or high lithotomy, and you separate the legs and try and make this urethra in a straight line. And this picture slide shows a lot of pictures of what you can find. Like what you see here is a stricture. So normally the urethra is about 1 centimeter in diameter. If there is a stricture or narrowing, it can be very small, up to 1 or 2 millimeters only. And then this shows transitional epithelial carcinoma or cancer. Then there are stones, tuberculosis, prostates, hypertrophied muscles. There is a hole in the bladder through which urine leaks into the vagina. This is a saccule and so on. A variety of abnormalities can be found using the cystoscopy. And one of the important things which you need to remember after cystoscopy is that it is common to have a little bit of burning while passing urine, minor bleeding, and also sometimes there may be minimal injuries to the bladder and urethra. And if there is any of these problems, then you need to report back and get antibiotics for a longer time, because any infection, a little bit of injury and infection can lead to scarring. So basically these two tests, both bladder pressure studies and cystoscopy, will help us to diagnose a variety of conditions and help in deciding the correct treatment.